Hi, I'm Dr. Scholz. Let's talk about prostate cancer. In this video, we're going to cover basic royal prostate cancer. Basic royal would be synonymous with oligometastatic prostate cancer. Oligo is a Greek word that means few, specifically 5 or fewer metastases. The whole issue with prostate cancer is whether or not it has spread, whether or not it can spread, how extensively it's spread. That's the number one defining factor in determining how serious the situation is and also for designing a treatment protocol. Historically, medical oncologists have concluded if any metastases have occurred, there must be many additional microscopic metastases spread throughout the body, even though they may be invisible on scans. This has led to a very negative viewpoint in terms of treating the metastatic sites with something like surgery or radiation. The old game of whack-a-mole comes to mind. You treat one spot, another one shows up. You treat that spot, another one shows up. And what are you accomplishing? So this conclusion that there's always additional metastatic disease that's going to show up down the line, if a single met has already been found, that is, has been in place now for over 100 years. So what's changed? Well, first of all, we realize that the biology of this disease is quite variable. Some cancers spread easily and other cancers don't. So not every single cancer that has an early spread will have additional spots, and this has been shown in a number of studies now. Therefore, this opens up the possibility of treating those spots with something like surgery or radiation. And in speaking of radiation, the radiation technology has improved so vastly in the last 10 to 15 years. These days, different spots throughout the body can be safely treated, usually with no side effects whatsoever. So there isn't much downside to pursuing radiation therapy to a metastatic site. When the number of sites becomes excessive, of course, there can be a cumulative effect, especially on the bone marrow where prostate cancer tends to spread. So the arbitrary cut-off threshold is usually about 5 spots max. That is arbitrary. More or less certainly would be debatable in specific situations. Another thing that has changed with the progression of technology over the last 10-15 years is the improvement of scans. So the types of scans we have can detect much earlier disease at a juncture where it's much more likely that that's the only metastatic site. So better scans, better radiation. We also have better systemic therapy, things like better hormone treatments, better chemotherapies. So while the radiation can take care of any visible metastasis, these systemic therapies can attack the microscopic disease that may be lurking in the wings. So a combination of radiation plus good systemic therapy is enhancing the possibility of achieving a cure. Throughout most of this video, I've been primarily talking about using radiation to treat the metastatic sites. Some doctors are using surgery. This is a potential approach in people that have primarily lymph node metastases, not bone metastases. Personally, I'm not a big fan of surgery because the radiation therapists can not only treat the affected node when they're detected on a scan, but they can also radiate the region and cover other potentially microscopic areas of disease in lymph nodes that are close adjacent. Surgeons go in and can remove the lymph node and a couple others perhaps, but they don't have an ability to cover a whole field the way a radiation therapist is able to do. Now, I'm sure surgeons will dispute this, and there are studies showing benefit with the surgical removal of cancerous lymph nodes. So what I'm saying doesn't completely preclude the possibility of surgery, but since radiation has so few side effects and is at least as effective and perhaps more effective, in general, I'm not a really big fan of surgery for oligometastatic cancer. So in summary, men that have early metastases should not give up hope. They should consult a medical oncologist who can talk to them about multimodality therapy with a combination of the right scans, radiation therapy, adequate systemic therapy possibly with chemotherapy or a second-generation hormone like Xtandi or Zytiga. And with this very aggressive approach, most men are going to go into a complete remission, and some can be cured.